A hearty good afternoon and welcome to the session on infertility and mental health. We are glad to have Dr. Saloni Srivastava among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thank you. Hello, everyone. I'm Saloni Srivastava, the counseling psychologist with Apollo Fertility Brookfield branch. So, today we are going to talk about infertility and mental health. Something that you would have heard. You would have heard articles about it, you would have known news about it. But something that we are going to go in depth about today is how infertility, a physical aspect, affects the mental health of both the male and female in a couple. Even though the fertility might be diagnosed in just one of the partner, it does affect the other partner equally. So we are going to delve more into that because you would have known about the physical aspect of the infertility, and majorly that's what we focus on when we work in terms of the IVF and IUIs and all of that. And when we do all those analysis of semen analysis and all XYZ things that we do in infertility test. But something that affects all these aspects, something that affects those analysis and the process, and something that is not much talked about. But I'm glad that right now a lot of hospitals are taking initiative to incorporate this aspect as well into the process of IVF and IUI, is the aspect of mental health. When a couple is given the report of infertility, be it because of the husband or the wife, or the man or the woman in the relationship, it does take a toll on the mental health. It does take a toll on a lot of other aspects of the mental health. Those aspects we are going to go deeper into. First one is the psychological aspect, then there is the emotional aspect, the financial aspect, the relationship conflict aspect. There are in relationship also, there's a relationship with the partner, there's a relationship that they have with their own self, the relationship with the family and the relatives and friends and all of those. Then there is of course the social aspect, the societal aspect, and there is the idea of it being a taboo. So we are going to go delve deeper into all these aspects. First, we'll talk about the taboo that is around the word infertility, right? So in earlier times, the only means of growing your family, the only idea of incorporating a child in your life was through natural means. But as the science has progressed, and fortunately now we have all these medical science procedures like IVF and IUI to give each individual an opportunity to be a parent. So with that advancement, of course, the taboo has decreased a lot, but that does not mean that still there is not, that conversation has not yet been spoken properly, openly into the society, and a lot of taboo is held against it. So if a couple is, given the report of infertility, they tend to be very scared, they tend to be very skeptical of how everyone around them is going to react to it. And as in the past I have seen in a lot of my patients who come into the hospital, we have worked through it that they feel that they don't want to involve their maybe families, their relatives, their XYZ people in their life, because they feel that they will hold a certain kind of taboo against this idea and they don't want to go ahead with that idea. So, because of that, we have seen a lot of distress. Whenever the reports come, the first thing that attacks them is how are we going to deal with it, in terms of telling maybe the parents, maybe, whoever XYZ person is then in their life. So what they decide to do is to not tell them, and not go ahead with the procedure without informing people, which is to an extent I believe is totally fine if it helps your mental health. But in order to keep that thing, in order to stay away from that taboo and not be addressed by this thing, what happens is they take a lot of stress, they start taking a lot of anxiety builds up whenever there is like a family function, There is like a reunion. People are coming together to meet each other, and the question of their family planning and all those things does come into picture. That's when it becomes very uncomfortable for them to stay in that position. And from there only we need to the second last aspect, that is the societal pressure. As a society, the norms has been that the natural birthing process is something that is only to be accepted in terms of increasing your family and planning your family. But it is not the norms now. We know that there is a lot of other aspects that does come into play, but because of the societal pressure, for example, a lot of couples do come in where their families have been pressuring them to plan a child, grow their families, and because of the taboo they cannot talk about the procedure that they might be going through. So they get stuck somewhere in the middle, which does hinder in their mental health process. It gives them a lot of anxiety and a lot of it is a research based finding that infertility, the report of infertility, does create trauma in individuals, and trauma is something that is very severe. So when we talk about trauma, we know that this is something that affects the day to day functioning of an individual. And once they get this report and they are under the societal pressure of planning a family, but also stuck between the pressure and the taboo, that's where a lot of trauma, depression, anxiety and stress related to this whole process grows up. And if the stress is too much in the women, it does affect the hormones of the women, and ultimately it affects the process that we are trying to achieve. For example, if a woman is going through IVF process or IUI process, it does get affected if there is a lot of anxiety and stress that they experience on a day-to-day basis. The next aspect is the financial aspect. Now, if we look at it as as an IVF process, it's in itself, it's a huge investment, and not just a physical and emotional investment. It is a financial investment, because it is a long process. It goes on for 9 days of injection, OPU, FET, and all those things. It is an investment on their part. And couples who did not plan the IVF process, when they get the report of infertility, it does take a toll on them, because now they have to plan, in of course in a consultation with the doctor, they have to go ahead and plan for their IUIs and IVF. And that requires certain kind of financial investment into these procedures, which when it is presented to the couple, it does take a toll, because a lot of families might not be coming from a very well-to-do background, and for them it becomes a very huge issue. They cannot also ask for financial help from others in their life, whoever their trusted people are. They might not be able to ask help from them, because in that case what happens is, then again they will be again going back to what we discussed, being stuck between the taboo and the pressure. So they are just stuck somewhere with the financial aspect as well. And they constantly feel stressed that if this process does not work out, which is a very real, which is a very quite a real possibility in these kind of procedures, as we know that medical procedures have their ups and downs. So we know that it can go either ways. So in that condition, that financial pressure, that financial aspects affect them a lot, and a lot of couples have been seen to experience a lot of conflict, inner conflict, external conflicts, mood swings, projection of their bad emotion, negative emotions onto something else. It has been seen because of this aspect, because they feel that it is a financial burden, and it is a financial investment, and with not even the 100% surety of it being a success, because it's a medical procedure. The next one is the interpersonal relationship. So first we will talk about the relationship that is there with the families and the relatives and the friends. So as human beings, it is our tendency to interact with people, to stay in touch with people. But what happens is, when you're trying to maintain that relationship with them, it does come across that if for example a couple is of 31 and 30 years, that age gap, at that point of time their friend circle, their relatives, all of them have certain kind of expectations out of them. In Indian society, we do look at relationship as something that is a huge impact. When we look at the Western culture, it might not play such a vital role, but here in Indian culture it does play a very very pivotal role in determining how the couple is going to experience a lot of symptoms of stress and anxiety. So a lot of anxiety does come into the picture, or a lot of depressive symptoms, a phase of depression does come into the picture when the couple is given the diagnosis of infertility, be it male fertility, female fertility, but they do experience this fear that now they don't want to get into social conditions, they don't want to meet the friends who already have their family. A lot of women have came in for therapy, just recognizing that they are experiencing a lot of depression because they have seen their friends have a child, and they feel that they are not worthy of being a mother, which does take a toll on the mental health of the women. So we have to work intensively with the women to make them realize that this is something that is just not in their hand, it is just a physical aspect. But of course that physical aspect is affecting their mental health, and ultimately it just those mental health again in reverse will affect the process that we are trying to achieve, maybe IVF, IUI, whichever one it is. So that relationship does get hampered, that relationship does hinder in the process of the IVF. But the most important relationship during the time of diagnosis of infertility, from the time of diagnosis of infertility till the time of the achieving a certain result from a procedure of IVF or IUI, the most important and vital relationship is the couple relationship. A lot of there are different kinds of couple and how they deal with this issue. Some of the couples are very encouraging of each other, they have had a very good unit system, they work as a team, and they both know that whoever's infertility it was, be it male infertility or female infertility, it is just a team effort, it is something that they both have to go through. And I have seen a lot of couples supporting each other through this time, which is what I work on to also when we do couple therapy sessions in here. That's what we try to achieve, that is to maintain a sort of balance between both the partners, where there is a basic understanding of how infertility is, what are the physical aspects of it, how to how are we planning to tackle it in the future, and all those XYZ factors. There are other couples also who are very aloof, who are so disconnected with each other for such a long period of time that to sit both of them down, to make them understand what is going on, all those aspects, um, it requires a lot, it requires a lot of couple therapy sessions to come to the conclusion that okay, both of you need to work as a team in this. Because this is something that I tell all my clients, that relationships are never 50-50. On some days one partner has to take the 80 and the other partner will take the 20, and on some days one of the partners will take maybe 70 and the other person will be taking 30. But as a unit, when you both come in together, it has to be a total of 100, because every day giving that same exact amount in a relationship might not be possible because of various XYZ reasons, but it just might not be possible. But as a unit it has to come to 100. So couples who are aloof from each other, who are not very connected with each other, this problem arises a lot, where we have to work on maintaining that balance, maintaining that ratio of the couple system coming back to a total of 100. And that's what we work on couple therapy for these kind of couples. And the third type of couple which comes in when the infertility issue is diagnosed is the couple which blames each other. Now this is a couple that is conflict based couple, and it's fine if if you are listening to this live and you feel that this is somewhere where you and your partner fall. It's fine to recognize yourself as this, but you need to work on it. This is the place where you really need to work on it, because when you go through a process of IVF and IUI and it does get successful, both of you are going to be parents and not just one person. So again, as I said, that it has to be a team effort rather than it being just one person blaming the other person that because of you this is not working out. When there is one partner is diagnosed with infertility and the other partner is shown to have no symptoms of it and everything is just normal, typical and all of that. In that condition, we see these kind of conflicts more, where the person who's diagnosed with infertility experiences a lot of blame. And they sometimes, a lot of relationships also do go through a tough time during this period, because a blame is placed on the other person that because of XYZ reason, because of you this is not happening. That is where we need to work the most, because if you enter the process of IVF and IUI with a feeling of blaming the other person, it might get successful, it might you might have the positive result, you might even have a positive result of pregnancy, but um, to enter that role of being a parent, to enter the role of being parents to a child and bringing up that child, it becomes very important that both the parents have some kind of understanding with each other. And if that is not created, then women experience postpartum depression a lot if the conflict is there since the beginning. And men also experience a lot of symptoms of postpartum depression. Now this is something that I recently realized, that people don't realize that men also experience postpartum depression. And female, of course, the female generation do experience postpartum depression, but it increases if the conflict between the couple is there, and a lot of blame, a lot of guilt, regret and all of that does come into the picture. Then it affects the couple system and how they tackle this new responsibility. So couple system is something that is very important during this time to maintain your mental health. If you don't have that communication, if you don't have that relationship with your partner, it becomes very difficult to go through this process. For us also, it becomes very difficult to navigate how to navigate through the couple. In therapy, we have seen a lot of couples who have come here who did not have such a huge issue. We at the beginning of when the procedure is going on, we find out that what is the probability of it being a success, and the chances were pretty high, and then also it turned out to be a negative report because of these kind of conflicts and mental health issues, which does affect the hormonal issue, the hormonal range in the body of the women. So it is very important to work on the couple system while you're also working on the physical aspect of the infertility. And the last two aspects are the emotional and psychological aspect. Now this is something that that goes very personal as well as with your partner. The partner aspect we already did discuss about the communication and everything, but when it comes to a personal aspect, when the news of infertility is given to the couple, it kind of comes as a shock because of the taboo, because of the ideas that are that are held behind the word infertility, how the society looks at it, how the society looks at IVF and IUI. So because of that, a lot of internalization happens of about feeling worthless. If the infertility is found in the partner, that is the male or the female, they feel a sense of guilt, they feel a sense of worthlessness, they feel a sense of not being able to help their partner achieve something that they want to achieve in their life, that is just being a parent. So all these very important factors get internalized, and this affects the mental health of the individual. And something that that has been experienced in the past, severe symptoms of trauma. There is also a sense of grief. A lot of research has also shown very severe symptoms of depression and anxiety is seen in these kind of individuals who internalize all these factors and make it a point that it is their fault. They go into a spiral of worthlessness, guilt, and feeling that they could not help their partner. Um, it it mostly happens with also couples who care too much about each other. They really want to be with each other, they want to be there for each other. In that case, it is even seen even more, because in those cases they feel a sense of responsibility for their partner, and they feel that they should have been there for their partner, done something about it, but they can't. So a lot of clients that I meet in my day-to-day practice, their concern is more about how they are not worthy of everything that their partner is doing, and they feel that why is it that they are the people who had to go through this. Let me be very honest. I have worked with dietitians, I have worked with gym trainers, and all these people have also been diagnosed with infertility. And when we think of taking care of our body, gym trainers, dietitians, all these people come to our mind in the first go, that these are the best people to take care of their bodies, and they also have been diagnosed with infertility. So sometimes it is something that is just not in your control. And if you are somebody who has been diagnosed with infertility, or somebody who has been diagnosed with infertility, the first step towards achieving that positive goal is to be empathetic to your own self. As if you are not empathetic to your own self, the whole procedure, the whole process of IVF and IUI does not make sense then, because you need to feel comfortable with your own self, with your own skin. So that is there. So these are the different aspects that we talked about that does affect the infertility and the emotional regulation of the people, both the male and the female infertility. Now we will talk about how do we tackle it, what do we do about it, how do if we do realize that there is like a mental health issue that does come into picture during these kind of diagnoses and procedures, how do we tackle it, how do we go about it. So first one that I do tell all my clients to focus on is individuality. They should look as this family planning and advancing of their family as a part of their life, a very important, a very major part of their life, but just a part and not their whole life. Because if they start thinking that this is their whole life, it becomes very difficult for them to maintain an individual personality, individual ideas. And that creates a lot of problems, a lot of emotional regulation problems, distress, depression, anxiety, trauma. It creates a lot of that because they feel that this is something that they were meant to do, but it is something that is just not happening with them. So that is something that we talk about. But in order to achieve that thing, we need to first focus on the communication part, the communication between the couple, the communication with the doctor, the communication that the clients have with their therapist. So, for example, I have seen a lot of clients coming in with the idea that when once they got the infertility report, once they were diagnosed with infertility, be it male or female infertility, they started to research about it on on maybe social networking sites, maybe on search engine sites. All those things they started to search about, how it is done, what are the pros and cons of these procedures, how does it go. Now let me be very honest, if you do search it on these kind of websites, what happens is there they talk about absolutely every case. And in medical procedure there are so many exceptional cases as well. So they are not those answers to your questions are not catered to really your needs, the person who would be the best person to cater to all your questions according to your personalized report would be your doctor. So if you have any kind of these kind of doubts, what is going on, what is happening, the best person to answer those questions would be your own doctor. And you should have a doctor by your stand to, to guide you through this process, because it becomes very easy if you have your doctor by your side. Other than that, there are different editorials that the hospitals release that I feel are very reliable source of attaining information. And of course, you should have your therapist, because that will really really help you to let go of the negative emotions, how to deal with all those negative emotions, and then be in a rational space, be in a balanced space to maybe judge how do you want to move forward from there. So that is there, that's what we talk about communication with your doctors, their therapist, and of course attaining information. The communication between the couple has to be very very open, transparent, and clear, because both the partners should have the space to talk about their negative emotions that they are experiencing because of this infertility issue in a very empathetic manner. To present that information, it has to be very empathetic, and that's what we work in couple therapy to make them understand how to communicate their emotions with each other. So that communication is very important. Maintaining your individuality, something that I really really focus on, and seeking couple and individual therapy help if you experience any kind of symptoms. Now, a lot of people do not pay attention to the mental health aspect, and they feel that okay, without this also it will work out. But it has been seen that there are three aspects in every IVF process that that makes it either a successful or a failure one. First is the IVF process itself, the physical aspect of it, the injections, the doctor, the consultations, your physical body responding to all those things, the scanning process, and all of those things. Second is something that is just this just the uncontrollable factors, the which are always there in any kind of medical procedure. So those are the things that is just somewhere there. We cannot really be 100% sure of those aspects. So we always remove that aspect and tell all the patients and clients very clearly that these are the chances of XYZ thing being successful. And the third aspect, which is again neglected a lot, but I feel that it should be addressed way more, is the mental health aspect, which affects the hormonal balance of the women. It affects how you approach this problem, the procedure, and all those things. So that aspect is something that you can really control, that that you can take charge of. And you can go for your therapy, you can go for your couple as well as individual therapy, which will really really help you to understand how to approach this problem and make it a maybe successful one. And of course, as I said, that the unknowable factors, that the second aspect that we talked about, is always going to be there in any medical procedure. But having a mental health support will always help you and make your chances be better than what it only will be with the physical aspect of IVF. That is the first aspect. So all those things are there. Other than that, the usual practice of if meditation, and again when I say meditation, I don't only mean that just dimming the lights and closing your eyes and going into those ideas. It's not meditation just that. If you're starting out at meditation can be as simple as you just sitting alone and just concentrating on something. That's it. That's how you can start. Playing music of very calm sound, for example, on on any website you can go and search for meditation music. Just sitting with that music itself can put you in a very very good position to make rational decisions. So when I say meditation, I'm not directly saying to go to the extreme steps, but to start small and slow. Of course, then there is also you need to take care of your physical health in terms of your diet, in terms of your fitness, and on XYZ things that the doctor will definitely consult you for. You need to keep a check on your emotions, like how you're feeling at one point of time. what exactly are you feeling? Are you addressing your own emotions? Are you in touch with what is happening around you? So all those things are a part of you taking your mental health very seriously. And if you feel that there is some kind of disconnection, there is some kind of discontinuity in what you are experiencing and what you're showing to the world, you need to seek therapy then, because it will really really help you to let go of the emotion. As I said, that this is a process that requires a lot of physical, emotional, and financial investment. It would be very very wrong to say that you won't experience any kind of stress or anxiety. You will experience it, but the point that you need to make sure of is that you need to let go of that anxiety and stress. And when you do that, then only you will be able to be in a position to make a better choice of how to approach this problem. So all these aspects, small things that you do through your day, will really help you to understand how your mental health is affecting the fertility, infertility, and how it can help you maybe get better results in the future. So yeah, with that we are done with the conversation of infertility and mental health. Again, as I said, that mental health is something that is very very important, and in the past I have also done a talk about how infertility affects the results of IVF. And that's where I have talked about research based ideas as well, where it talks about that mental health does affect the results, maybe not directly, maybe not in a very direct sense it affects, but it in somewhere it does play a role in determining the positive or the negative results of IVF. So I hope if you are listening to this live, and you know somebody, or you are somebody who are experiencing all these kind of things, I would really appreciate if you do take that step of seeking help, mental health help. And when that happens, you yourself will feel that you're now able to make better choices. You're able to make choices that really really help you in advancing. And I wish all of you all the best for your future. Thank you.